My name is Bill Warner, and I just kind of want to walk you through our website here. Thank you for jumping on our website. Let's Okay, what I'm trying to say there is this web page is for those who are 65 who are coming onto Medicare. It's going to show you when you need to start, if you need A and B, when you can apply, how to apply, the two basic paths, getting a Medicare supplement or a Medicare Advantage plan. It's a good idea to talk to your broker. Our office is right here downtown Glendora. We'd love to talk to you soon. You could book an appointment on this website, or if you could just fill out this sheet, we really think it's going to help you get to the bottom of most your Medicare questions. Hope this helps. Here's our storefront. We are downtown Glendora in between Crust and Crumble and its place. And new coming soon, drawn to art, fine instructions for 4-year-olds to adults. There's Natalie. She's going to take Bodie for a walk and drop off the mail. And this is the office. Got parking in the back for you. Here's the rest of the staff. That's Rami on the right, Mike coming in from the right, then Katie, then Kirk in the middle, then Natalie, then Reiko, and then me. The following presentation is what we do with our clients the first time they go on to Medicare. We think this will help you just get to the bottom of what needs to happen now that you are eligible for Medicare when you turn 65. Medicare can start. Well, if you hit this drop-down box, you're gonna find your birthday. So if you're born between 4/2 and 5/1, your soonest start date's 4/1. Okay, that's the soonest you can start Medicare. Medicare is generally a pretty good deal, so knowing the soonest you can start, you're gonna want to start probably as soon as possible in most situations. So the soonest start date's important. So, but if you're born between 7/2 and 8/1, you're gonna need to your soonest start date's gonna be 7/1. For my purposes, I'm gonna select somebody starting soon right here on April 1st. Okay, so let's say this person's born on April 15th. Maybe that's your situation. Okay, so now when can I first apply? And this is for the government part of Medicare, for Medicare Part A and B. Well, you have a 3-month window, 3 months before your birthday month, 3 months after your birthday month. Okay, so if we click that drop down box, you could find kind of if you're born between such and such dates, these are the days you can apply. Well, I'm going to select that top one because I'm assuming that I'm saying I'm born in April. Okay, and then the next question, or well, and let's talk about that. So when can you first apply? Let's say if you apply after your birthday month, your effective date won't be the first possible effective date. Your Part B effective date will be, if you apply during your birthday month or after, your Part B effective date will be first of the following month after you apply. Now, your Part A effective date is going to be retroactive to the first day of your birthday month, or whatever that first day you could have started would be. Okay. And then the next part is how can I apply? Well, a simple way, well, if you're already receiving Social Security income, you don't need to apply, but it's going to go through the drop-down box. You can apply online at ssa.gov/Medicare. That's the best way to apply. You have to create a login. It does take about 30 minutes, but if you need help with that, reach out to us. It is kind of a personal process. It is your Social Security website, so that would mean a lot of trust. But I would give it a shot. If you have any questions, let us know. We'd be happy to walk you through that. Okay, and then we have. You could also call the Social Security office, or I think you can call your local Social Security office and see if they'll schedule an appointment. Sometimes your local Social Security office might even take care of it over the phone for you too. Okay, so now the next question is, do you need to enroll in Part A and Part B by age 65 and 3 months? So that would be the last day of your window, right? 3 months after your birthday month, 65 and 3 months. But so some folks are wondering, do you even need to do anything? So well, let's say if you're insured through your employer and you like your employer plan, but your employer has under 20 employees, you still need to enroll in Medicare A and B. You will, the if your employer has under 20 employees, that plan's designed to work as a secondary to Medicare. So if you don't have Medicare Part B in place or A in place, you could potentially be on the hook for those charges. Um, for those costs, I should say. If you're retiring or losing employer coverage, yes, you need to enroll in A and B. If you're covered under a spouse's employer and that spouse is retired, like a spouse's past employer, but they're still offering coverage to you guys, if he or she is retired, yeah, you need to enroll in Medicare Part A and B. Even if they didn't need to, you need to. Okay. Um, Yes, or let's see. If you have an individual health plan, if you're insured through Cover California, yeah, you need to. If you have or if you have your own individual health plan, yeah, you need to enroll in Medicare Part A and B. We talk to people quite a bit. They're getting very low premiums for Cover California, which is a great deal, but that plan was supposed to cost $800 a month. You've been getting a tax credit for $800 a month based upon your income. Yeah, you're gonna need to jump to Medicare. It's not going to be free. Generally, if you're getting a tax credit, you're in the small group of people that actually are ended up paying more when they meet Medicare. It's kind of because you've been getting a killer deal for a while. Or for while you're on Cover California. Okay, so I know maybe that's not the best way to say that sales wise. Um, Second, here we have. If you're on TRICARE, you do need to enroll in A and B. TRICARE is going to work as a secondary to B. If you're in COBRA, yeah, you need to enroll in A and B. So that's the drop down. You're going to want, obviously, if you're on COBRA, you're paying absorbent prices. A and B is going to be much better priced for you. So you are definitely going to need to enroll in A and B. If you don't enroll in A and B, there could be penalties down the road. Okay, so. Pick one there. I'm gonna say yes. I do not. Uh, I'm gonna say yes. I do not have health insurance with an employer with more than 20 employees. Okay, so I'm gonna enroll in Part B, and then the next question is, or I'm gonna enroll in Part A and B. Can I? And the next question is, can I enroll in Medicare Part A only and forgo enrolling in Part B without a penalty? Well, yeah, you can if you're insured through an employer with more than 20 employees. And yeah, if your spouse is still working and you're insured with that employer with over more than 20 employees through that employer. In all other situations, basically, no. Even if you don't have to, you should check with a Medicare agent. Check with us. We'll see. You might be paying a lot for your health insurance plan. You might have a high deductible. You might have a high max out of pocket. We have a lot of people that, even though they are offered coverage, they are getting a plan through us because because it's better. Okay, Medicare is a really good program. And then last question here. This is kind of overkill, but are you penalized if you don't enroll in a Medicare Part A, if you don't enroll in Medicare Part A? Well, um, no, if you qualify for a Part A premium, you're going to want to because it's free generally. Most people pay or don't pay anything for it. But if you do have to pay for it, if you didn't work 10 years in the United States, you really should enroll in a Part A initially, because they are going to penalize you once you finally do enroll. That's very rare. I run across not very many people a year that are in that situation. But I'm going to go ahead and select no. I qualify for zero premium Part A. Okay, so that's kind of the legwork here, or that's kind of the housekeeping. At the very bottom of this web page, you're going to be able to print a report that saves these answers. So please answer these according to your situation. So I'm going to say I'm not. I'm going to say I'm going to do online at ssa.gov, and I'm going to say yes. I do not have insurance or an employer for the Part B, and this one I'm going to say no. I don't. I can't forego, and then I'm going to say no. I qualify for zero Part A premium here. Okay, so now the government part of Medicare, let's explain the benefits. So, Medicare Part A, It covers the hospitalization. It has a per occurrence deductible of $1,736. So every time you're hospitalized, you're on the hook for the first 1736. Okay. Basically, every hospital in the United States accepts Medicare. It's an unbelievable network. Like if you need to go to Hoag for your hip surgery, if you need to go to Cedar-Sinai for your neurological situation, if you need to go to City of Hope for cancer, Medicare Part A allows you to go there. Medicare Part A allow you to get opinions at all three places, no questions asked. All three places would be happy to see you too. Okay, so that's a big deal. We have access to really good care around here, and Medicare can get you there. So, and basically, you have a per occurrence deductible of 1,736. You're on the hook for the first 1,736, and then they pay the rest. Okay, so what's that going to cost you if you click the drop down? Most of you did pay 10 years of Medicare taxes, so please click the $0. If you didn't, for the very small majority, pick the price. That's what you're going to end up paying for Part A. Next, Medicare Part B. This is your medical, doctors, labs, outpatient surgery. This has an annual deductible, not a per occurrence deductible. So this is like you go to the doctor, or maybe you're getting chemotherapy, you're going to have a hip surgery, you're going to have a cataract surgery. That's all covered under Medicare. Part B, okay? And it has a very broad range of doctors. If you want UCLA to take care of your eyes, perfect. Whoever you want. I mean, unless they're, you know, if they're going to work out of these major institutions, they generally are in network with Medicare. It's the largest network of doctors on the planet. Okay, so now we have so that has an annual deductible of 283. So you're going to pay for your doctor bills through the year until you spend a total of 283. So you go to the dermatologist, they charge 40. You're going to pay 40. You go to the ophthalmologist, they're going to charge 40. You pay 40 or whatever they charge. You go to the orthopedic now and they schedule your surgery. You've only paid $100 so far. Well, you're going to have to pay 183 to meet the deductible, and then you're going to pay 20% of whatever that cost is. Medicare is going to pay 80% of the cost, but you're going to pay 20% of that surgery for an unlimited amount. So that's the downside to Medicare Part B is it doesn't have a cap. It has great doctors networks. It does have a rather low deductible, and the coinsurance is good. It's going to pay 80%, but you're still on the hook for 20%, no matter how high that bill is. If it's a $100,000 bill, you have to pay 20% of that bill. So what's this premium going to be? Well, this premium's based upon your 2024 income, and I could make that more clear on here. But if we look at this drop down, we want to go off of what your income was in 2024. And so I'm going to say my income, I'm married, and it was, let's just, for this video, I'm going to say it's under 218,000. So my premium is going to be 202.90. If you can just find your income, we don't keep this information where this is a drop down box for you to help you navigate your Medicare situation. But just go through here, find your income. If you're married and your income's between 274 and 342, just click that, and it'll show you what your Part B premium is. This will help you when you generate your cost analysis at the bottom. It'll give you a printout of exactly what your costs are. I'm going to go back and change this to 202.90. Okay. And so that's original Medicare for you. That's Medicare Part A and B. So really good hospital coverage. You pay the first $1,700 though per visit. Really good hospital access. Really good doctor access, but you owe 20% to the doctor basically for an unlimited amount. Also, the downside is there's no drug coverage basically. If you go to the pharmacy, Medicare Part B really doesn't pay for those medications. So now let's get to the private part of Medicare. Okay, this is where really agents get involved, and this is I just kind of want to show you what this kind of is what we help our clients do, and this is what most of our clients have been doing. Either, well, you can only do one of these two paths. So there's two paths to Medicare. The first path is so to go forward with any of this, you need to be enrolled in A and B. So you would have need to already gotten your Medicare ID number. Okay, so that takes about 3 to 4 weeks after you apply for Medicare. Okay, so start early on that Medicare A and B if you know you need to enroll in it. Okay, so path one. Well, we this is the three ID card path. This is where you're going to keep original Medicare as your primary, you're going to have a Medicare supplement, and you're going to have a prescription drug plan. So you're going to have three ID cards in your wallet. You're going to show the original Medicare card and the supplement card to the doctor and to the hospital, and you're going to show the drug card to your pharmacist. Okay, so um, most people, or so this is most people. Okay. Um, all right. So it just says the same thing over again. Sorry about that. But Medicare supplement plan summary. Okay. So Medicare supplement plan works with Medicare. Medicare pays first, then the supplement pays many of the remaining costs. Basically, if Medicare pays for it, the supplement will pick up the leftover 20%. Okay. So if you, or that's for doctors, but for Part A, let's talk about how the Plan G works. The Plan G is the one of the most popular Medicare supplement plans. The Plan G typically pays the Part A deductible. So basically that means when you go to the hospital, you don't pay anything. Medicare, the hospital deductible is paid for, and the 20% Part B coinsurance. So you don't have to pay the 20% after the 283 deductible. So if you have an outpatient surgery, the most you're going to pay for the whole year for all your outpatient costs is $283. That's good. That's pretty good. Um, so perfect. And so what does the Plan G affect your doctor access? So this is a big part here. So Medicare supplement plans do not have doctor networks. That's good. If a doctor accepts Medicare, the supplement will work. Basically, they don't have any authority to tell you what doctor you can go to. Medicare, if the doctor accepts Medicare, the insurance company has to be a good little insurance company and pay the leftover bills that Medicare didn't pay, like the 20% or the $1,700 hospital deductible. Basically, this doesn't allow a private insurance company to have to go through an authorization process or to steer you to doctors. Okay, so we generally work out of Glendora. So this drop down box is find a Plan G premium for a 65-year-old in 91741 zip code. The Plan Gs don't really vary in price that much. I mean, yeah, there is a $40 spread here right now. Blue Shield's competitive. They have their rate increase in July, but I would say it's generally around $200 a month. Most of these companies give you $25 a new to Medicare discount, and then most of them also give you household discounts, whether that's 10% off or 7% off. But the Plan G costs $192 a month. Please pick a price there. That way, at the bottom, when you get your cost analysis, it'll have something to put in there. Okay. So now we have prescription drug plans. So Medicare supplement plans do not include prescription drug coverage. Most people add a Part D. You kind of need to add a Part D. You're penalized if you don't. Prescription drug plans to cover medications. The standard Part D deductible for 2026 is $615, and the annual max out of pocket is $2,100. Um, Generally, if your medications are on your plan's list of covered drugs, your prescription drug costs will not exceed $2,100. So there's a 12 of these plans available. Most of our clients are on a plan that costs under $6 a month, and some of them are they're at City of Hope getting these big chemo pills, and they're capping out at 2,100. Okay. Um, and so the coverage is pretty good. I mean, it's not free, right? But where the cost can get expensive is that $615 deductible. So if you're taking Eliquis, Xarelto, very common. I see those a lot. Januvia, um, things like Zepbound now, if you're having sleep apnea, it looks like that's being covered under Medicare Part D or Wegovy or not Wegovy, Ozempic. These things you do have to meet the $615 deductible, but then after that, the copays do go down considerably. But the worst case scenario is 2,100. Okay. But basically, there's 12 plans available. When you talk to an agent, they just type your list of medications in, and it'll tell us what plan covers your medications best at your particular pharmacy. Okay. And then the other thing too, and we could always change your drug plan during the open enrollment period between December 7th or between October 15th and December 7th. You can update your drug plan. So for drug costs here, I'm going to put in $5.70. I think you should too. I think that's just to give us a cost. I think that'll help. And then, excuse me. And then for the Part D IRMA, this you also have to pay more if you made too much or if you made more money in 2024. There is an IRMA charge so for your drug plan. So find that wherever your income is. So if your income was between 274 and 342 and you're married, you are going to pay 37 $37.50 a month on top of your Part D premium. I'm going to go ahead and put zero that I made under that. One thing that I skipped over on the Medicare supplement plan, you have a unique situation when you turn 65. You can get onto a supplement plan without having to answer medical questions. You basically have a 6-month window from your Medicare Part B effective date to enroll in that supplement plan without any medical questions. And then as you're on that plan during your birthday month, after the time to change the supplement plan is during your birthday month, at least in California, it's during your birthday month or 60 days after your birthday. So if you start off on the Plan G, that's the best plan you could get. There's other plans like the Plan N or the high deductible Plan G. Let's say down the road, the cost does go up as you get older. You're able to shop different supplement plans during your birthday month, and you can go to a like or lesser plan without having to answer medical questions. The insurance company has to take you. If you have a pending surgery at Hoag or Cedars-Sinai, that's going to be a lot of money, and you are in your birthday month, you can sign up for a new plan starting the next month if it's like or lesser and not have any pre-existing conditions held against you. They can't deny any claims for pre-existing conditions either. So, but the time to do that is during your birthday month. Okay. But now let's say if we don't go on the supplement, if we miss that 6-month window, well, it's now in a lot of situations they're going to ask you for medical questions, and we would have a hard time getting on the Plan G if we have any sort of medical history. Okay, so that's kind of one of the things to think about. That's it. You have a unique opportunity at age when you first get onto Medicare A and B to get onto a supplement, and the supplement you get on matters. You could do like the high deductible Plan G, which is really low cost. It's only like $50. That has like a $3,000 deductible. But if you choose that, and it probably would be a good choice. It would just be a lot of administrative work because you'd be paying all the bills as, up to basically a $2,900 deductible. But you would save a lot in the premium and you have access to a ton of doctors. The issue with that is just if you ever wanted to go to the Plan G, that would be without a deductible. With that small deductible, it'd be an upgrade. So you'd always have to answer medical questions if you wanted to upgrade your plan. So you'd have to be rather healthy to do that. So, all right. So we got that. So now we're going to the path 2. This is the One ID card path. This is you replace original Medicare with the Part C Medicare Advantage plan. So these are these are getting more and more popular. And actually, they kind of leveled out. They were getting real popular and kind of surpassing supplement. And now I think last year the enrollment finally tipped a little. These ones you can enroll in, right when you turn 65. You can also enroll in without any medical underwriting every year between the on the open enrollment between October 15th and December 7th. Okay, so what happens with the Medicare Advantage plan is basically you still have to pay your Part A and B premium. And so zero for Part A for most people. You pay whatever you're paying for Part B. You're still going to have to pay your Part D IRMA as well. Um, but basically, other than that, the Medicare Advantage plans are free. I'm going to go ahead and enter that. They're generally free, at least in Los Angeles County, very cheap, and they're willing to take your business at any time. So they're not charging you anything, and they're willing to take your business no matter how sick you are. So what they do basically is you say, hey, I'll cancel out my Medicare benefit, and that Medicare benefit, the money set aside to pay for my Medicare insurance will go to you, Medicare Advantage company, and whether it's and then that Medicare Advantage company now is going to take care of you. So this is definitely the low cost option right now for an individual buying a Medicare Advantage plan. I'm not aware of one that allows you to go to City of Hope, but for folks that it definitely saves you. You don't have to pay the Plan G premium or the Part D premium, right? So it usually saves folks when they're turning 65. It's usually about $200 a month less than if they did the supplement plan, and that's generally why they do that. The people that usually go on these types of plans are folks that like their primary care doctor and like really like their primary care doctor, and they're used to an HMO plan. And they're usually people that haven't had issues, any well, these plans actually work very good for people managing diabetes, but for folks managing cancer, it's a little bit tougher. Generally, they have less access to things like that. And so it just takes basically on the Medicare Advantage plan, it's kind of like the Medicare supplement plan. When you go to Disneyland, it's like if you go to Disneyland, you get to go on all the rides and you get to take the short line. On the Medicare Advantage plan, you get to go on a ride, each type of ride, and you kind of have to take the long line. And in some situations, to get on a ride, you have to prove that you went on another ride before you could get on the ride. So you on a lot of these Medicare supplement or Medicare Advantage plans, they're going to want you to do certain things before particular procedures are done. They're going to definitely want to have you see your primary care doctor before you go to a specialist for certain situations. However, with that being said, if we scroll down here, these are the four ones that we seem to work with the most. And as you see here, you can go ahead and if you click on this, it'll pull up in a new page. It'll give you a summary of benefits for each one of these. So you'll notice that on the PPO plan, PPO means you can go to a specialist without a referral. You generally have more doctors. The copays are going to be higher. Usually, the way it works on Medicare Advantage plans, the lower the copays and the lower the max out of pocket, really the smaller the network of doctors is. So just take that into account. So, the Aetna plan, I think the max out of pocket's like $6,700. Back on here. So, okay, so the Medicare Signature PPO plan has a max out of pocket of 67. I think the 6,700. The Scan Classic has a max out of pocket of like 200, but they compete a lot with really good customer service. And but the United Healthcare, they are this ARP Medicare Advantage plan. They own Optum. Optum's huge. I don't know if they own Optum, but they're basically sister companies. And they kind of have a monopoly, and it seems like Optum works really well with United Healthcare. And then this Humana Gold Plus, that's been a very competitive plan lately. They give a lot of money out for dental and vision. But you have to be enrolled in Medicare Part A and B to do this. Okay, so that's the Medicare Advantage plan, and it does include prescription drug coverage. It covers your hospital, your doctors, and your drugs. It does, but basically you usually pick a network of doctors, or you can do that PPO plan with Aetna. That's a little bit larger network. But really, for more info, you can go through these PDFs, and if you have questions, we'd be more than happy to answer those for you. So here we go. So now let's click here to create my Medicare cost summary. Okay, so now it should give you your Medicare enrollment summary, like what you need to do, when, what your plan of attack is, what the cost would be if you did a Medicare supplement plan, and then what the cost would be if you're going to do um, a Medicare Advantage plan, and you could see it's about a $200 difference. You can just kind of make a screenshot with your phone by taking hitting the buttons like that and save that. Or you could maybe you could even send that to your printer. And then you might have to take two because the way it's set up, this really works good on your computer. It'll print out just in one sheet. But yeah, so I definitely think this should get you in the ballpark for what you should be doing. This is what we go through with our clients. It is a little bit of a, there are some Medicare supplement plans we could talk to you about. And there's also, we could get in the weeds on the Part C Medicare Advantage plans as well. But definitely, you definitely want to talk to an agent, figure out what your medications are going to cost exactly. All these plans, they have gym memberships, things like that. You might want to get spiffed up on that. But as far as your two basic choices, there's really, in our area, just because City of Hope's so close, and well, there's a lot of good medicine close to us. We're kind of in a weird spot where I mean, the doctors are great here, but we're like in California, but we're in the eastern side of LA, and it seems like a lot of talented people want to live on the other side of town. So being able to have access to like Newport, like Hogue, and being able to have access to Cedars-Sinai, sometimes that's valuable. So sometimes having a PPO plan or like a Medicare with the Medicare supplement and D is worth the extra bit of money. People are living a very long time right now, and this medicine does work. That's why it costs so much. It's because it's useful. When you need a orthopedic surgeon, or sometimes it's nice to be able to get multiple opinions, and also to know that and to be able to do it rather quickly. So, but so cool. So I'm rambling, but thanks for your time. I hope this page helps you, and I hope to talk to you soon.